What services can be added to a family practice? In addition to the family physician consultation, what services can be added? Lab tests, vaccinations, yes. Diet plans, very interesting. Medicines or pharmacy, yes. These are the most common ones. Physiotherapy, very nice. Diabetes practice, health checkups, immunization, disease screening. So yes, you all have the right ideas that, yes, and these are the initial ones to start with. The lab tests, immunizations, health checkups. These are easy to start. And then you can also have in the period in which you are not practicing, you can use that chamber to invite physiotherapists or dietitians to help out patients. A counselor could also be brought in, mental health counseling, yes. Or you develop the skills to do counseling yourself. Very nice. Health camps is not a service in itself, it's a pro bono thing that we do. Same with health talks, but yes, if you can get paid for health talks and health camps, why not? That could be another additional service. Ancillary home treatments, thank you so much. So, and that make sure that you get a good staff who can do home visits, do sample collection, do injections, and they can also do wound care for people who come in with minor wounds, and they should know how to give tetanus shots, for example. So they can do that with your supervision, of course, but you don't need to be actively involved in doing all of this. The staff can take care of a lot of these things and generate some revenue for the clinic. You can do specialist things like smoking and alcohol cessation. Right. So if we have time in the end, we can discuss one of these ideas, one or two of these ideas, and see how we can add these to the family practice. I think we are getting a few questions about pharmacy, adding the pharmacy, so we'll discuss that. Minor surgery, very nice, Dr. Vikram. So minor procedures you can start doing. INDs and with the lady physician, then IUD insertions. So these are the 5 strategies for the opening stage. Focus on communication skills. Make sure at least you give the golden minute for the patient and encourage them and listen to them intently. Available on days that other doctors are not available on, and make sure you're present on the internet. Learn as you see patients. Note down the patient's unmet needs, and they become your educational needs. Always a good history and examination. And one by one, we add additional services which bring in additional revenue. All of this will set the stage for growth. All right, so now we are going to the growth stage. And this is the time to invest in a good EMR, an electronic medical record. Why is that? Because I mean, you could do it in the initial stages also, but initial stages you can experiment with different EMRs and see which one suits your practice, and then by this time you would have some extra money in the growth stage to invest in a good paid EMR who would provide you good support also. An EMR forms the nucleus of continuity of care. As the patients come in, then you can keep on looking at the previous notes and say, okay, last time you had come for this, last time this medicine had worked or not worked, and this is what we can do right now. For example, in UTIs, it's very important to look at what the previous culture report was, just to get to start the empiric antibiotic in this visit. And a lot of times patients do not have their records, right? So if we invest time, that becomes an additional bonus for the patients also to come to our clinic, that this doctor is meticulous enough and cares about me enough to note down everything that I'm telling him or her, and make sure to review that before they see me next time. It is also about legibility. So in the last, it's a good prescription on the left, but hardly anything is legible. On the right, it's very legible, and everyone is on the same page about what's happening to this patient and what the diagnosis and what they need to take and how much. So this is the difference that EMR can do. Now this is also the time to keep on sharpening your verbal and non-verbal communication skills. So if you see this doctor, he has a very open stance, he's smiling, he's looking at the patient, very good eye contact, and giving the patient space, leaning forward. All of these are non-verbal skills that help to put the patients at ease. There is nothing in between the patient and the doctor. A lot of times our table is between the doctor and the patient. Also, the patient is also sitting comfortably, not on a uncomfortable stool. And verbal communication skills can also be used. So use of nodding and reflecting back on the patient. So you mean this, or you mean that, and summarizing at the end. You know, you told me so far this. Am I right? Is there anything else you would like to add or correct in this? So you make sure that you sharpen all of these verbal and non-verbal communication skills. This is also the time to develop special interests. And there are two reasons for that. One is that you will start seeing that your community of practice needs certain specific things which they are not getting. You're not getting where to refer these patients to because there are no good options to refer to. So there is a need there. On the other side, after a while, taking care of mild diseases, seasonal diseases becomes, let's say, a bit boring. So if you have special interests, that gives you an avenue to keep going and learning new things and making sure that it's always fresh, whatever you do. This is also the time to start learning skills that help you do shared decision making. A lot of our care is paternalistic. So we have been trained and grown to say that I know what is the best thing for the patient. And what I prescribe, the patient should follow verbatim, line by line. And we get offended if the patients don't do that. But it's very important to do some shared decision making during the consultation itself. So make sure that we are on the same page. So we do a lot of information sharing and say, have you understood all of this information that I've given you? If you have any questions on this, and these are all the options that you can do, especially true for chronic diseases and lifestyle diseases. So many different types of exercises that can be done. So we can discuss the options and then say, okay, which one of these is looking good to you? And whatever they say, you note it down in the plan that okay, this was the shared decision making. This is what we've agreed on: 30 to 40 minutes of brisk walking, either in the morning or in the evening, more on the weekends if possible, and things like that. So that helps to in the next consultation when the patient comes in for follow-up, you can follow up on this and ask them, okay, did we follow through and what were the challenges for this? The conversation can be more personalized. And that's what ultimately we want. You will start developing your standard treatment templates for common things. But at the same time, patients are looking for personalized care. So they don't want a cookie cutter, copy paste thing. If you saw during COVID, so many of prescriptions were floating around, and everyone was taking all of those medicines. This is the standard treatment for COVID. But what was needed was personalized care. So based on whatever symptoms you have, you give symptomatic treatment, and more than the medicines, you give them comfort that this is mild and this should get better. Even if at all it gets worse, you would only probably need just the nebulization to get better. So all of that personalized care was missing, and this is where you can really come in the growth stage, and this is where we make a difference for the families and patients. And ultimately, this helps us to not just to grow outward in terms of more patients that we are seeing, more things that we are doing, more services that we're doing, but also growing deep roots in your community of practice. And by that I mean developing deeper and deeper relationships with the community through all the patients of the same family, all the people in the same family are coming to us. And also we are also going out in the community to do home visits or other things that help the community.